Welcome, everybody, to the MAP podcast, the Mental Health and Addiction podcast. We are coming to you today from Fact TV, which is Foxboro Access on cable. So it's something new for us.
We're on TV now.
We are stars.
Makeup.
Famous or infamous.
It's kind of scary, right? Quiet on the set, everybody.
Okay. All right. Here we go.
All right.
Today, like we mentioned last time, we are discussing insurance issues, the ins and outs of insurance, what you can expect, what you can do to fight insurance if you're having issues, and a myriad of other topics that you're going to find fun and exciting and useful. We hope.
We hope.
So we're going to I introduced myself. I'm Kimberly Walsh. I'm here with Andrew Bernstein and Kristen Perry Long. We are the MAP.
The MAP.
The map.
All right, let's get started, guys. Let's dive right in.
All right. So we're going to be quoting and reading some stuff, and all these links will be available for you to go back and dig a little bit deeper. We're just scratching the surface. Patrick Kennedy wrote an article back in December of 2019, and the opening paragraph says that 70,000 Americans died of an overdose in 2017, yet insurances spent only 1% of their total health care dollars on treatment for substance use disorders. And that's a decrease from 2 years earlier. I think that's just...
So what does that mean exactly?
It just means that they're not investing any money into substance abuse. Therefore, this disease is never going to go away.
And even more discouraging than that is, and I can't quote this, but I did read this somewhere, is that they're saying that they're adding more services to things like cancer and they're tracking the mortality rates in like heart disease and cancer, and they're statistically going down, but in mental health and in addiction and overdoses, while they're adding more or less services, they're actually going up. The statistics are going up. There's more mortality, more deaths, more overdoses.
So it hasn't gotten better.
So it has not gotten better. In fact, it's gotten worse.
Because they do say that it actually has gotten better in a lot of...
In different areas, different niche areas, that's gotten better. Like we saw the trend in overdose deaths go down in 2018.
It went down, but what people aren't like acknowledging, it drives me crazy. The numbers have gone down in the state of Massachusetts. Okay, they might have gone down for fatalities, which is amazing, and I'm not knocking it, but the amount of people that are addicted is gone up.
Right.
Like, do you know what I'm saying?
Absolutely.
So it's great that the numbers of overdoses have gone down, but statistically, it's just going to recycle. Eventually, those numbers are going to skyrocket up again because that's just the way that history works.
Yeah, and it gets around. You have to remember too, the things like Narcan is out there. So
right.
So everyone was able to, leave Narcan next to them while they, did
they had the Narcan parties.
Yeah, exactly.
Yeah.
Which is insane.
I heard about that. What is a Narcan party? Just...
Okay, so a Narcan, it's not a Narcan party, but it's using responsibly, which is great. So what happens is they get together, they make sure that they all bring Narcan, one person uses, and if they don't go out, then the next person uses, so on and so forth. And it's kind of like making sure that you have Narcan, and if you were to go out, I haven't used, so I can Narcan you.
Okay.
Make sense?
Yep.
Okay. It's
and by go out we mean die, right?
Not out, yeah.
No, okay.
Start to overdose. But I mean, you still hear about kids that are coming in and 2, 3 at a time, and Narcan was sitting right there on the ground because, if you don't go out right away, it doesn't mean you're not going to overdose because there's that long period of time that you can overdose.
Not only that, but fentanyl was introduced as well, and fentanyl is not you can't as easily come back from
Correct.
a fentanyl overdose.
It takes more Narcan.
More Narcan, and oftentimes they say don't have it more than the one dose that you get in the
thing.
in the container.
Now, if I'm looking for mental health and addiction support or help, okay, how do I do that? Like, what is the process? Because I think there's a lot of moving parts to this whole thing. How does it all? How do you do this?
So if you were to go straight mental health would have to be your primary. And there are multiple hospitals that will accept you that are primary mental health. That's all that they accept is mental health. You can have addiction as, a secondary disease, but your mental health has to be primary. So what happens is you have people that fluctuate. They go between primary substance abuse and then they go back up to mental health. So, we talk about Section 12s. Section 12 is a 72-hour hold where you go in front of a crisis team and they deem you either you need a higher level of care, some mental health help, or they discharge you because kids are going in and saying they're going to kill themselves because they want to get off the street, and that's the only way that they can get help. So the mental health is primary, and there are mental health hospitals. Typically, you go in and you get about 2 weeks to be stabilized based on...
That's not enough time, right?
No, it's not enough time.
Right.
I mean, they're giving them all kinds of meds. There's no way your body can be stabilized in 2 weeks. I mean, think about it like what we were talking about last time. With Zoloft, it takes a month for it to build up into your body
Right.
to be working 100%. So how can in 2 weeks, if you're giving somebody, 5, 6 different meds for depression and sleep and anxiety, and how can those all balance out in 2 weeks?
It doesn't.
It doesn't.
Right.
It takes
Right.
it takes at least like 60 to 90 days for your brain, even if you got off everything, to somewhat get back to normalization
Right.
mode, right?
Clear.
So
To get clear.
to get clear.
Yeah.
Exactly.
Yeah.
So I guess really the question to me, or the question for people out there is, okay, a lot of buzzwords. Where do you go? What do you do? Like, is there a central place, to gather more information about insurance?
About insurance?
Yeah,
Well,
about
there's-
what options are and what the terms are. I know we.
Oh,
had some-
yeah.
Yeah, for mental
so
health.
there's you can go to
NAMI, right?
NAMI. I didn't.
You can also go to the substance abuse.
I don't
has some
think SAMHSA
information.
has.
SAMHSA doesn't have.
I don't think SAMHSA has much on information, but NAMI is really good, or NAMI is really good. They have a
What's that
wealth
stand for?
National Alliance on Mental Illness, but they have a whole. They've got a lot of information. There are a lot of people that write about insurances, and you can actually call an insurance company and they'll explain it to you because they're selling you their insurance, so they're going to make it look fantastic. What we're going to kind of scratch into is some terms and some understandings that people maybe, like a carve out. Not many people know what a carve out is, and if you look at the back of your insurance cards, it'll say a carve out. So a carve out is basically, it's like having a subcontractor. So
Okay.
Right.
but
So
we'll
you
dive
got a
into
net,
that.
and and so a network will say, "Hey, I'm going to sell this package of services that I don't want to do. I'm going to sell it to some other company." So the other company is now in charge of performing those services for that network.
Right.
Right. So then when you go, it was the same scenario that we talked about. So you go to get your surgery, and you think you're in network because you are. You went to your in-network doctor, and it turns out the anesthesiologist is not in network. He's a carve out.
And the insurance companies will send you a bill thinking that they can sneak it by you.
Right.
Yeah, and that's where, again, we talk about accountability. That's where you have to verify so you don't get stuck
Right.
with a big bill. So if they say, "Oh, you're fine," no, I got to call my provider and find out.
Right, but who's going to do that? Especially if you need like
Oh,
emergency
Right.
surgery, and who's going to hold on? Stop the clock. Could I please call my provider and make sure that this anesthesiologist is going to be covered in my insurance? Because that's not, you can't, it's unrealistic. It's up to the hospital to say, okay, you know what? Joe Schmo has Blue Cross Blue Shield, PPO. That's an in-network, that's an out-of-network insurance, okay? And we should only be using out-of-network providers. So that means that, you're out, but you're in because you accept those insurances. It's the same thing with
Right.
programs.
Right.
You can either go to an in-network program or you can go to an out-of-network program. A lot of programs now, though, are accepting both.
Okay.
They are in and out of network. They're able to take in-network insurance, which is opening up it's opening up so much more for more people because a lot of people don't have those PPO policies.
Well, then you have mass health too. right?
Then
So
that's a whole nother ball
That's
of wax.
another whole.
you see, this is really
nightmare.
confusing. I think to the average
It
person, it's like, okay, I can't even navigate this stuff. It's not a user friendly. Not me, but I'm just saying it's not a user friendly.
It's not. And so that's where self-advocacy is critical. It's paramount. You have to really advocate for yourself to understand these things. You've got to call, you've got to do some homework. No one's going to do it for you, and they don't have someone that's going to walk you through it. You have to literally go on, learned a lot researching about this and stuff I didn't know, and you kind of have to for yourself, because if you get hurt and you don't have these things in place, you're going to have these bills. Thank you. You're going to have these bills that
See, we're on
you're not gonna be
TV
able to
now,
pay.
and there is no room for error, right? So you have
edit
to
it later.
behave. You have to behave. You can't make faces at people when we start doing call-ins, and we have guests. You can't. It's
a
like you
little
can't go
levity,
like
folks.
this, ba ba ba. You can't do any of it,
Right.
right?
All right. Who wants to read about this? I want to call it Purity Act, but it's the Party Act.
It's parody.
Parody.
Parody,
Here,
Right.
You read it.
Oh,
read
really?
it.
She's telling me to read.
but don't read it verbatim.
No, we can read it verbatim, and we can tell them where we got it, which is read where you're reading this from. That's what I did.
Okay. So I'm
And this link is going to be available on the MAP
all
Facebook
right.
page.
So despite
That's right.
despite my protests, I'm going to read from this American Psychological Association. It's talking about what you need to know about your mental health coverage. So we're trying to gear all of this information to be applicable for the mental health aspect of your coverage. So, as you know, through Obamacare and through the Parity Act, insurance companies are required to give their patients, their insured, as much mental health coverage as they give for any other physical health issue that they have. So if you are going in for cancer treatment, you better get just as much coverage for substance abuse treatment as you get for cancer treatment
And mental health.
and mental health. Exactly. So,
And people don't know that.
no,
Right.
they don't.
They're like, nope, you get 2 weeks and you're all better.
That's not the case. So
No.
there are things you can do. So you
No.
have, basically, federal government is not enforcing the Parity Act,
Right.
which is what the problem is. And so as long as they can get away with it, the insurance companies are going to go, no, I'm not paying for that. We're not paying for that. It's not in your
We're
coverage.
going to make it difficult.
or we're going to make it difficult, or you're going to get, or we're just going to bill you if that's going to be something you have to pay for yourself. No.
Right.
So we're talking right now about outpatient, or are we talking about inpatient as well?
any mental
Any
health,
mental health.
Okay, so
even your own therapist.
okay, all right, got it.
Right. So it covers basically anything. And what we were referring to earlier with the carve outs and not being in network just basically means that there's a group of doctors who came together or in a hospital and said, we are willing to charge less, but that we're insured that we get all the patients from this specific local area. Right? That's all it means. So if you go out of network, you're going to pay more, which is your choice. You have a choice to do that. But the parity laws that come into effect when it's required that you either have a specialist or that you go out of network, it has to be equal. You just have to have equal
Let me
coverage.
explain the network carve-outs, and this is from healthychildren.org. State and federal laws require that health insurance networks are accessibly based on the needs of the population and the geographical distribution. For example, all medical networks must have primary care physicians, hospital, labs, and specialists within reasonable distance of every patient in the network wherever possible. Does that make sense?
Yeah.
Get it?
Yep.
So that's a network carve-out.
Okay. It's crazy.
Yeah.
What are some of the other terms out there?
Well, she's gonna share a little bit more about the
So basically, the law requires insurance companies to treat mental health just the same as they do to any medical or other surgical coverage, which is kind of like what I just said. So this is required. So an insurance company can't charge $40 copay for an office visit to a mental health professional if it only charges $20 copay for any other visit. Okay, so these are the things that you need to look for in your insurance, in your documents.
So you mean like specialists? They can't charge you more? Specialists can't charge you more for a copay?
Not if they charge on, like, say, say it's a
So my
specialist.
primary is $25.
Right.
But when I go to the dermatologist, it's a little bit more.
Okay, that's fine. But then if you go to a psychologist, it can't be any more than that.
The primary or the specialist?
Specialist.
Okay, so it can't be any higher than, okay. I
Right.
gotcha.
So comparable services have to have comparable copays.
So the brake police is coming along.
Yes.
And we're
Here
gonna
they come. I can
we're
hear them
gonna
now.
we're gonna take a break.
Okay.
All right, and we'll be right back.
All right.
Sounds good. Welcome back, everybody. We're here with Andy Bernstein, Kimberly Walsh, and Kristen Perry Long. We're discussing some insurance issues. And let's get back into it. We had some tips for you to navigate the insurance world when it comes to either or. So mental health issues, substance use issues, or just any care you need to receive from your doctor. These are the 9 secrets that health insurers don't want you to know.
Ooh.
We found this on Health Magazine website,
Yep.
health.com.
So it says you don't have to pay if you don't have a say. So when purposely seen out-network doctor, your plan usually makes it clear that it'll cost you, but you have surgery. Oh, we talked about this one.
Right. That's the
anesthesiologist.
that's the anesthesiologist. So basically, if you don't have a say-so, if you didn't get to pick the anesthesiologist to decide that you wanted someone in network, they can't charge you for it, which is makes sense, right?
Right, and a lot of times, like when people go into treatment, they are allotted X amount of UAs,
Right.
and
Which is
Urinalysis.
urinalysis.
okay.
Drug testing.
Yep, drug testing, and
Urinalysis.
And we constantly see in this that treatment centers are overcharging, and they have their own billing companies, they have their own labs, and they're over testing. I had a mom once. This is kind of funny. I had a mom once. Her child was in treatment. He was in treatment 2 times, and she got a bill for $50,000 for UAs.
Oh, that's incredible.
$50,000.
Well, that's a whole cottage industry on top of so a lot of treatment centers, aren't they?
Yeah, they all have
setting
their own
up
labs.
Because
Oh,
I
yeah.
saw it when I went out
Yeah.
to Nashville.
Yeah.
Yeah.
They have their own labs, which is a whole separate line
It's a
item.
whole nother
Sober Living's are doing it, too.
nightmare.
Because now, if they bill you, now they're billing the drug screening on top of.
Right.
Exactly. It's just another whole scam.
Yep.
What a hustle!
It is a hustle.
It really is.
Be leery. If you're going to a sober living home and they're doing testing through cups and sending it to a lab, run. They're going to charge you inordinate amounts of money for it.
Now,
Yeah.
sober living on your end,
Right.
with Brady's Landing is a cash only, right? I mean,
It's-
not
well, it's
cash, but
self-pay, right?
self-pay.
Right.
PS,
Cash
they're-
only. They come in with
Well,
Ching ching.
ching ching. No.
whatever. No, they there is no insurance code for sober living. That
Right.
I get many calls. People say, "Hey, I've got my insurance. Can I use insurance to pay for my sober living stay?" And no, you can't.
You can use your insurance for halfway
residential.
houses or residential, but yeah, you can't.
There's no code
And
in
even
the
in
insurance.
even when people go into IOP, so intensive outpatient,
Yep.
And facilities will have housing with IOP, they actually have to charge rent because you can't have
Can't bill.
IOP with housing.
Right.
Okay.
It's because then it's residential
So,
treatment.
but they usually don't charge very much because they're mugging your insurance.
right.
Crazy. Okay,
Yeah.
so what else do we have? What other ins and outs here?
So the first one was don't pay if you didn't choose the doctor, you don't have to pay for the doctor, right?
Yep.
And then you may be eligible for more coverage. So you get to check with your state on that one. Like for Maryland, for instance, those health plans there, they pay for fertility coverage. But if
They
you
do.
go,
Massachusetts does too.
do they? Okay.
Yeah.
They do?
I mean, we did it.
Oh.
Yeah.
Yeah. See, now Virginia doesn't. I don't. California doesn't. So you got to know per state what you're entitled to,
Right.
and it changes each state.
I'm really good at this. Stall first, answer questions later.
Right.
Yeah, let's see. Yeah, I mean, I guess so here's a perfect example. I went yesterday to my follow-up. I've had all these cool tests, right? And my insurance denies them. I get letters that their tests have been denied, but then I go to the office, it's like, oh, no, we got approval. Like I had a stress test, but they did it like a nuclear stress test. Never had that before, whatever. I lasted 7 minutes on the
The treadmill.
Like riding a bull, like a
7
mechanical
minutes.
bull.
It was like
Yeah.
pathetic. But anyway, my insurance denied it, but I was like, I can't do this test. My insurance, I got a letter. I usually don't open that mail, but I got a letter, right? She's like, no, you're all set. But I got hit with a $55 bill, and I'm like, what is this? You have a balance of $55. I'm like, I've paid my copay. She's like, no, it's like a $15 new patient charge and then a uncovered charge for the, and I'm like, I don't know. I will talk to my insurance. I'm like, those little things add up.
Sure.
But I mean, yeah.
When I got surgery, that cooler that they give
Oh,
you,
yeah.
it's a $250 cooler.
Cooler? What do you mean cooler?
It's a big,
Looks
we
like
ha-
bait.
we have-
You're going to put live bait in it.
it's
Like-
a thermos, and you put water, and it has a tube, and it has this sleeve that you put on your shoulder, and
Oh.
it ices it, and it's great. My son had one. My sister-in-law had it. We borrowed it.
But they build in $250 for
Your
it.
insurance?
Yeah.
You need it, but yeah, your insurance doesn't cover
No,
it.
it doesn't cover it. So I had to pay the $250.
Now, what could have been done differently? So could you have said before?
Yeah, I don't need it.
Yeah, you could say, am I covered?
Is
Is
it
that
a
covered?
necessity?
Yeah.
Well, I think they tell you, do you have one
Yeah.
ahead of time?
Do you need to have one that's attached to a little thingy? And can't you just
Yeah.
put a cold ice
It's
pack or a
great.
bag of
No,
It was
vegetables?
great. It was good.
It's great.
But still, like, that's like, but they didn't tell you, right?
No.
Yeah.
Again, self-advocacy. It's
Right.
it's educating yourself. It's knowing what your rights are. Knowing
Well, it's
what
like
you have.
crutches and
That's true.
wrist splints and all that crap that they give you when you walk out of the doctor's office. So you go to your doctor now because you broke your wrist, right? Your
Right.
doctor takes the X-ray, right? And they're like, all right, now you got to go to an orthopedic doctor, but we're going to splint you. Guess what? Sometimes the splint isn't covered.
Right.
Now you got to go to an orthopedic. You got to get another X-ray, and now you're going to get a cast, but it's covered because it's an orthopedic. So you see, like
The little
the little.
So before you leave, you need to check. Just if you're leaving with anything, if you have an apparatus of some sort,
Ask.
Just know these things. What am I going to get later?
Nothing's for free.
Nothing.
Come on, let's get real.
So going back to the insurance, if somebody's out there, okay, so it's like little Johnny is suffering and he needs to get into treatment. And what
What kind of insurance does he have? That's the key.
right. So if he has,
I hate asking that question when I get my phone call. Hey, I want to go to treatment. Okay, that's great. What kind of insurance do you have?
right. That's a tough thing.
It sucks. It sucks that it determines.
It does. So the moral of that story
So
is,
yeah. So what about little Johnny?
So if little Johnny wants to go to detox, can he go to detox?
Yes, whether he has insurance or not. There are DPH beds in the state of Massachusetts. But
DPH?
Yeah, Department of
Public Health.
Yeah, DP, Public Health. Yeah, I had to think about that. Not enough coffee. But it's based on availability.
Okay.
So what we recommend is that there are various hospitals throughout the state of Massachusetts that have kind of stepped up, and they will keep people safe until we can get them into a detox.
Got it.
And keep trying too, because a lot of them have scholarship programs where they have enough funding that comes in, or they're a 501c3, and they can actually support having someone come in and use the detox space. That happens a lot too.
Now, are we able to put all these things on? We're going to put all these things on the Facebook page.
On Facebook
Yeah, I'll
page,
put all these links. I'm going to put all the links. We have to finish our list.
Yes, because I also want to talk to you guys about, Chris, I want to talk to you about, since we're in Foxboro, I wanted to talk to you about the stakes are high.
Oh yeah, the stakes are high. My
Kind of
baby.
give us a little
baby.
insight on that, see, because
Up there.
we're literally like
Stone's throw.
a stone's throw. So, but
Yeah, I will. We'll get back to that.
okay.
I think it's your turn.
Oh,
Doctors are good weapons.
doctors are good weapons. Well, I'm actually more fond of the research one.
Okay, you do the research. Okay, so doctors can be good weapons. And what they mean by this is that 9 times out of 10, your doctors are empathetic. Is that the right word?
Yeah, empathetic.
Empathetic towards whatever it is that you are suffering from. And a doctor also has the power to kind of override a no, but you have to have them go to bat for you. In other words, like if you need mental health, your doctor can call, let's just say McLean Hospital, because it happens to be one of the mental hospitals in the state of Massachusetts, they can call, they can speak to somebody and say, no, you're missing this. I've been with this client for 4 years. These are the patterns that I'm seeing. Just because today he looks good, he's going to go home tonight, and he's going to, flip a shit. Like, a doctor can advocate for you. That's their job. Like, that's what they're supposed to do.
And if you don't ask, they don't know.
Right.
So you got to,
They
again,
won't go the extra mile typically unless, you kind of push them and ask and beg and plead. And, my favorite thing when I go, because I have 5 kids, when I was going through stuff with my kids, tough decisions, not necessarily like just stuff. I love putting it back on them. If this was your daughter, what would you do? And they hate that.
I bet they do.
Because you're like putting them on the spot. What would you do? And they have to answer you in a
At least somewhat honest.
somewhat honest, but like generic answer. But you can tell by the way that they're leaning, whether it's necessity or non-necessity.
Right, exactly. That kind of still also goes along with again, we're back to self-advocacy. It kind of keeps coming back around to, you'll get what you want when you ask for it. And when you fight for it, that's kind of,
But that's part of the
and that's part of life.
doing the homework, right?
It is part of doing the homework, exactly.
Right, because nobody's going to do it for you.
No, they're not. And again, that's the same thing with the research. If they want you to get an MRI or a CAT scan, well, what if you only have a stubbed toe? You don't have to get the MRI on the foot. You can say there's a list online that says, and we'll put this on the Facebook page as well, that says what injuries need what imaging.
Right.
So the foot, you only need an X-ray. You don't need an MRI. That'll tell you everything you need to do. But sometimes they go overboard, so you got to watch that piece too.
Exactly.
Yep.
This one's, I don't know. There are always ways to get drugs cheaper. Yeah, there's all kinds of new incentives. The best thing for you to do is to check with your insurance carrier and ask them if they have any.
Generic.
Well, yeah, because it's funny because I take Adderall. Shocking because I have ADD.
Oh.
But
Did you take it today?
I did take it today. I did take it today. But you know what?
Poor Andy.
I'm at the pharmacy. I have to go to this pharmacy rather than in my town because they never carry the name brand of Adderall. So when
Mansfield doesn't?
no. So
Why don't you don't want to take the generic, or they don't?
No, my prescriber gives me Adderall regular, not the amphetamine salt, which is actually what the generic name is.
Yeah.
So I basically have to go to Foxboro.
Wow, a whole extra 3 miles.
I know, but my point is there's a the fact that, it's like, well, I didn't know this.
But technically, your CVS, you can tell them they need to get it. They can get it for you. You could tell them you don't have the means to get to Foxboro, and they have to get it for you.
What, 3 miles? I'm sorry.
You know what I'm
They may
saying?
not have
I'm
much
sorry.
empathy.
I can't cry.
No, but you know what I mean. Like,
Right.
we have rights, and I think that people just don't realize that, we're allowed to push back.
Right.
We're allowed to push back, and kind of why we're diving. And I didn't mean to jump into you on this one, but kind of why I wanted to jump into the whole insurance thing is, I have a family that I've worked with for, going on 6 years now.
As a recovery coach.
As a recovery coach
Yes.
and advocate.
Yep.
And they have 2 children. Their first child, it was almost 6 years ago, and they came to me. They had a Blue Cross Blue Shield HMO policy. And at the time, there were no in-network programs. Like, they were non-existent. And she was having to go around through the Massachusetts programs. And at the time, I happened to be working for an out-of-state program. It's a good program. Long story short, I told the father, who was the insurance carrier, to go to his boss, go to his HR, and ask if he can purchase a PPO policy. They did it. They got it. And he went to treatment out of state, and he's been sober.
That's awesome.
He did great, right? Well, child number 2 came around. They have the Blue Cross Blue Shield PPO.
PPO or HMO?
PPO. They kept it.
They kept it.
And again, in and out of treatment, finally ready, goes to treatment, and insurance is like, we're counting your detox, your 7 days in detox as part of your residential. They can't do that. We're going to discharge this client after less than 14 days of what should have been 7 days of detox, and he should have had at least 14 to 21 days of residential. And the parents were irate because this person was finally engaging. He was done. They were done. They wanted help. They wanted to get well, and now they're getting pushed out the door. And so I told the dad, I'm like, call insurance. Tell them, you pay a lot of money every single month. This is not right. They're going to push back a little bit. Well, this gentleman's company, the owner, really, really stand-up guy, called the insurance, called Blue Cross Blue Shield, called his insurance broker and said, either you fix this and get this person the 21 days that he's entitled to, or we're pulling our contracts.
Nice.
And lo and behold, he got what he needed. They didn't get hit with a bill. They're doing, this person's still doing great. And yeah, so they pushed back a little bit. They pushed back a lot of it, actually. They went and they advocated for themselves. They advocated for their child.
Right.
And that's what we need to do. We have to fight. As parents, we have to fight for not only our lives, but for our children's lives. And, these people that are behind the insurance companies, if you don't think they are not suffering from substance abuse, you're kidding yourself, because they have it in their house too. They just
have the money to take care of it.
Correct.
Yeah. It does. It solves a lot of problems. But
How does dual diagnosis fit into all this?
So dual diagnosis. So that goes back to primary. So if you're primary substance abuse and you're dual,
your secondary mental illness.
Your secondary is mental illness, then you can go into any dual diagnosis program, which everybody says they are right now.
But they're not.
But what you have to look
That's the new trend.
it's the new trend.
Yeah. Well, we're dual diagnosis.
We're dual diagnosis. What you have to look for, the questions that you have to ask is, if you're true dual diagnosis, do you have on-site psych? Do you have a psych doctor that is there, 5 days a week? Do you have a psych doctor there that's able to prescribe? Do you know what I mean? Like, those are important things, because everybody wants to say they're dual. We have great clinicians, level 4, master level. They can handle, no, they're not licensed dual diagnosis.
And here's the thing, at the end of the day, it's a chicken and the egg thing. At the end of the day, you don't know if you're primary mental health or primary substance abuse treatment unless you go in to treatment and stop doing the drugs that got you in the first place.
Right.
So unless they've done this multiple times, they don't even know which one's primary, yet generally speaking.
Well, you watch, when you work with people over time, you watch, they go in with the substance abuse because that's what they're active in. They get clarity. They get some, good, solid recovery under them. And then the mental health starts to surface. Right. And it's, sadly, it's the mental health that takes them back out to go back into. So we just keep cycling and cycling and cycling and never really addressing the mental health part of it.
The root of it, which is really at the end of the day.
Right.
Let's say one in five Americans has the mental health issue. So
we know people. We know someone. He could. This person could be sober, but not really addressing the core issues.
Right. Not working a program.
Not working a program, whatever that may be. Yep. So it's kind of like it's a Band-Aid.
Yeah.
It's just a Band-Aid.
It's sad. It's really sad because we just keep cycling these kids through and through and through. We never really get or adults. We never really get to the core of the problem. And what I have found, in working in treatment for as long as I have, I've discovered the places that actually really do dive deep, that dive beyond the substance abuse and address it. And they do exist. They're few and far between, but they do exist. And the differences is these people are staying sober. When
we get back because we got to take a break, but when we get back, I'm bossy today.
You are bossy.
You're bossy every day.
I am not.
Did you take your anti-bossy pills?
I'm Bossy McBoster. I'm the Bruce Springsteen, the boss.
Oh, the boss.
But
No.
we should take a break.
Right. Yeah,
How
absolutely.
about that suggestive? Do you think we should take a break?
Oh, that's much better. Even though he's going to hit the button whether I say
Let's
yes or no.
take a break, and then you mentioned, and I think this would be good, some facilities. You know, maybe you can kind of give a little bit of insight on what people should be looking for,
Okay.
and go from there.
All right.
Sounds good.
All right, we'll be right back.
Welcome back to The Map. This is the Mental Health and Addiction podcast with Andy Bernstein, myself, Kimberly Walsh, and Kristen Perry Long. We are going to wrap up this segment today with Chris talking about her baby, her labor of love. The stakes are high.
Right,
But-
in the shadows of the stakes of high.
Yes.
Or stakes are high.
high.
Stakes
We're in the
are
shadows.
high. We
Yeah.
are in the yeah, we are in the shadows. So for a long time since I've been doing this, people do these events on August 31st to raise awareness. A really dear friend of mine, Kathy Leonard, started it in Marlborough, Massachusetts, where she put purple flags out in front of the library for the current year. I believe she started in
What do the flags represent?
a life a life lost to accidental overdose. And I believe she started in 2015. So from that, going to that first event, and that was like the most, I can't even explain it. It was really hard. But I think what was harder was sitting on the hill with all these families, knowing that their child's life was represented by a purple flag. That was really hard. That was like a visual that kind of stuck and burned with me. And I was like, I think what we should do is we should progressively add each year, right? So, 2015, 16, 17, so on and so forth. So last year, I finally did it. I bit the bullet, and I rejoined back up with my cohorts, the Foxboro JCs, because I needed their support. They're a great not-for-profit organization. It's all community-based. They're just good people. I started with them when I first moved to Foxboro in '99. Anyway, so what we did is we put just under 2,000 flags up on the common this past August.
Okay.
And they stayed on display for a week. And then we closed the week out with a small gathering, a few guest speakers. Justin Clancy came and he played some music. I love him. And it was really powerful. My goal for it actually is to be able to create an event to thank all the first responders, because they go unthanked.
They're unsung.
They're unsung.
Some unsung heroes. They
So
really are.
I was just up at Liberty Bay in Maine this past weekend and touring Liberty Bay. It's really cool. And they have Maine Mental Health. She came to the Lunch and Learn. And there are these programs. There's one in Massachusetts and then up in the Maine area. It's called TIPS, TIPS. And they do an annual event thanking.
Oh, nice. The first
It's a
responders.
big, like they have a night and they do appetizers, and then they do a short video highlighting all these various, towns and their unsung heroes. And then they do the end of the year with like, I guess a big award. So I'm going to be in contact with them to kind of like coordinate, because they're up, in that side of Massachusetts and we're down here. What led me to this, besides the mere fact of, I think that people's lives need to be, you need to see it to believe it.
Yeah, that's the visual.
The
That's
visual
the-
was
the
crazy.
visual.
Yeah, it
right.
was
These aren't just statistics. These are actually, like you said,
Yeah.
visual.
thousands of flags on the over the hill there.
Yeah.
Yeah.
It was unbelievable.
Yeah,
It's
it was
so
it was
impactful.
cool watching all these people put these flags in, and then we closed the day with people pulling the flags, and that was really kind of cool too. But kind of what led me to the first responders was this past April, I lost one of my kids, not my kids, one of my kids, to an accidental overdose. And he was an only child, and he left behind a beautiful little girl. And, you know, I've been blessed. I've met some amazing people on my journey. And his mom is a very close friend. And when he overdosed, the ambulance came and they took him to the hospital. And it's one of the hospitals that I had said that, you know, the hospitals are changing. You know, when you can't get somebody in, I tell them, go to the hospital, be nice, be polite, you know, they'll take care of you. And this particular hospital was where he frequently went. And so they went to the hospital, and we all didn't really know the details. We just thought he died alone by himself. And that's really hard. That's really, really hard. But what really happened was he was brought into the emergency room, and they worked on him for over an hour. The nurses and the doctors worked on him for over an hour. And when they finally realized that, you know, they couldn't bring him back, they called the time of death, and then they had a moment of silence.
Aw.
And I can't imagine, like, those nurses, because these kids, they grow on you, you know, they grow on you. You create that relationship, and to see these kids come in over and over and over again and dying, it must take a mental toll on them.
Absolutely.
Yeah, I guess PTSD apparently with EMTs is extremely high.
Yeah.
I can imagine.
Seeing.
Yep. So it's those people that we take for granted, that we get angry because they didn't save our kids. You know, you got to go beyond that. How we found out about this was that one of this mom's close friends was in the room next to and heard all that was going on, and didn't put two and two together for like a day or two. And then she called the mom and told her that she realized that it was her son that was in the room next to her. And I mean, I get goosebumps I get goosebumps thinking about it. And it's like, you know, God works in mysterious ways. And so I really think that, like, our EMTs, our police, our doctors, our nurses, you know, they need to be thanked.
They deserve recognition.
Yeah.
Absolutely.
I mean, we do a lot with the veterans.
Yeah.
You know, thank you for your service. Thank you for your service.
So the stakes are higher is going to do something to recognize them?
I'm working on it. It takes money.
Yes, it does.
I'm not a millionaire, so I'm going to be ramping up and getting that going again. So, you know, in August. But like I said, I'm going to get in touch with this program. It's called TIPS, TIPS, and find out what they do.
And maybe the map will be there. Maybe we'll be there broadcasting.
Yeah, we will be there.
We will be there.
Definitely bring you more information as we get it, for sure. Kristen will let us know.
You know what? May I suggest something?
Sure.
Rather than being bossy.
You could try.
But you had mentioned about, we talked about insurance and facilities, and we never touched on that before we went to break.
Right.
So
am I naming a facility?
No.
Okay.
Just give people an idea of what they might need to look at when
they're choosing an insurance company, or choosing a treatment center.
Choosing a treatment center. You know, like
some questions.
Some questions to ask yourself, and then also, I guess, and this is a weird question, but is there a way to determine, like, oh well, the insurance has a good relationship with this particular facility?
Sometimes, because an insurance company will have a good relationship with a facility if they're doing it right, if they're not abusing it, if they're not overbilling, if they're doing all the things right. And those facilities do exist, believe it or not. When you are putting your loved one into treatment, if you have the opportunity, go and see it. Go and see it. Like, would you buy a house without seeing it? No. Would you buy a car without seeing it? You know, no, you wouldn't.
Would you get surgery without meeting the doctor?
Exactly. Try to go and see it. You know, it's hard sometimes when we send them out of state. You know, it's a wish and a will that it's going to be okay. But the things you want to ask: do you have a psychiatrist on site. If you're a dual diagnosis, do you have a psychiatrist? Really, what are their names? And then do the research. Find out if they really do, and find out what the,
And how many times are they seen?
right, how many times have they seen? A lot of places will be like, oh, you get you get case management. So one of the last places that I worked for had 11 different people that touched your loved one. They all had different jobs. Case management, you got a buddy, you got a mentor, you had a clinician, you are a therapist, you had, I don't even know, I can't remember. You had a psychiatrist, you had the doctor, you had
Probably a
nurse, right. I mean, all these 11, and they really broke it down into each person, had a job. And what it did, by having 11 different people touching your loved one, it allowed the therapist to really focus on the therapy. A lot of places have therapists, but the therapists are doing the case management, because you have case management that has 36 clients, and how much time can you, I just had a gentleman that gets me angry. He was in treatment for 6 weeks, and they were getting him set up for a sober house, and he's on MAT. And they
medicated.
He's on Suboxone.
Okay.
And they neglected to ask if they accepted Suboxone. So now he's on his out date tomorrow, and they're like, "Oh no, we don't take you on Suboxone." There's not a whole lot of houses that take you on Suboxone in the state of Massachusetts.
Right.
So that's a challenge in itself, but they never asked. So now he's supposed to be out. So now you got a kid who's 6 weeks sober, right? Been on MAT for 6 weeks. He's doing great, doing beautifully, and he's getting discharged tomorrow to the street. I have a problem with that.
Sure.
I have a really big problem.
So
But
you
anyway,
want to check out their what kind of relationships they have with sober homes,
right.
Because that's a critical
sober
piece.
homes, case management. Typically how many people does your case management carry? That's an important question. How many times do we get to meet with a therapist? In the facility that I worked with, they were allowed to call the therapist in the middle of the night. That's how they hired their therapists. Their therapists were 24/7, 365, and that's how they ruled.
That's probably not a standard, though.
It's
I would
not a
think.
standard.
Right.
It's not, but it's about going over and above, and really wanting the best for your loved one.
Absolutely.
Like they didn't want to see you again.
Right.
So it's important. Ask all the questions. If your gut is saying, is your food brought in, or do you cook it on site? Like little things like that are really important.
Right.
Check the employee notes in Glassdoor.
Yep.
Find out what their employees think about them.
That's a great point.
Keep
Right. Do your homework.
do the homework.
That's really the moral to this.
Yeah.
that is the moral of this whole podcast.
Yeah.
Is
Do your
that
homework.
Do your
Do
homework.
your research and be your own advocate. And if you want good care, figure it out.
And, and don't be
There's
afraid
plenty
to
of-
reach out to people.
Right.
Exactly. There's plenty of people that can help you.
You reach out to Chris or you,
Yeah.
That's
Kimberly.
We'll have that.
If
all
I
that
don't know it, I'll
information.
find out, or I'll find you somebody that does.
Exactly.
Right,
that's how I
because
roll.
that's really the people that work in this industry. The really good people are very dedicated and willing to help.
Yeah, you want someone like Chris on the front lines who knows exactly what's, especially locally speaking.
Right, right.
Yeah.
Chris is very dedicated. You both are very dedicated.
Getting there.
So
All right.
I
Well,
think that does it for us, doesn't it?
that is our show for the week.
Whoop, whoop.
Oh wait, we got to say thank you to Michael.
Thanks,
Well,
Mikey.
He's our producer extraordinaire.
Yes.
Runs this operation.
Back TV.
And Nancy,
Nancy.
My mom,
Nancy's mom. Hi, Nancy. All right.
Visiting us from Arizona.
Arizona.
You know what that means.
That's the sound that takes us out. You've been listening to The MAP, the Mental Health and Addiction Podcast with Andy, Kimberly, and Chris. We'll see you next time.